Hello viewers, we are in conversation with Professor Davies from UK and Dr. Kamal Gulati from AIMS New Delhi. So ma'am, you're welcome to the AIMS Jamo talk show. So we were discussing about the leadership and the healthcare program. So now you people are taking it a step forward to the healthcare leadership. What is this program, ma'am?
So we have a joint University College London AIMS Delhi research project that's looking at medical leadership. So how can we help with development programs and other interventions to support physicians, especially women, into senior leadership roles like CEOs of major hospitals.
So what would you like to add in this program?
I would like to add that in our previous research, the research which we have conducted at AIMS in New Delhi so far, we have found that the significant medical leadership competency gaps exist in the Indian healthcare system, both in public sector as well as private sector. So this project is an extension of our ongoing research in the area of medical leadership. And thankfully, the National Health Policy of India 2017 gives us the national mandate to invest into leadership capacity building in our healthcare system. And I think that it's a good idea that AIMS Delhi, being the premier medical institute, along with other AIMS which are coming up under the PMSSY scheme, should take the lead to develop leadership capacity in our healthcare system. And for this initiative, we have collaborated with University College London with Professor Davies, and we are doing a comparative study about medical leadership assessment amongst the doctors in UK and the doctors in India.
What is the national importance of this program?
So it's hugely important. Healthcare systems, hospitals are very complex systems and organizations, and medical schools do not prepare physicians to be senior leaders, for example, with health economics, finance, marketing, human resources, strategy. So it's very important we develop these hybrid leaders who are entrepreneurs as well and credible in both the bedside, the clinical, their surgery, their own discipline, but also credible in the boardroom as well, working with senior people, investors and the wider community.
So I would like to know that why is it required at this hour? Like why are we talking about the healthcare and leadership together now?
I think that it is now urgent and timely because our national health policy gives us a national mandate, number one. Number two, India is undergoing significant national public health reforms through two major schemes of government, that is the Pradhan Mantri Swasthya Seva Suraksha Yojana, the PMSSY scheme under which the various 22 AIMS are being established across the country. The second important reform, I believe, is the Ayushman Bharat scheme. So these are the two major ambitious reforms of the government of India, and I think at the same time we need to build leadership capacity so that these two reforms can achieve their desired objectives in an efficient and effective manner.
Thank you so much for your wonderful time. In the end, I would like to have a brief note from ma'am and so both of you, that what would be the message to our young generation or our healthcare workers or the people who are aspiring to be either they want to go to MBA or they want to be in healthcare profession, or either they want to choose both. So what is your message, ma'am, to them?
I think if you're going to be successful, you have to speak many languages. So you have to speak the language of business, government, clinical, and so on. So I think developing that capacity to talk with different stakeholders to make change. And also from the gender angle, clearly we need to use all the talents.
Yes. Thank you, sir.
Yeah. I would like to add that India being a lower and middle income countries, I think we have a huge population and our investment in healthcare is comparatively very low compared to the Western context. So our young generation should be ready to do multitasking, they should be more efficient and effective, and I think it would be a good idea if we start including leadership and management topics in our medical education system right from the undergraduate level, like the one being in the England using the NHS medical leadership competency frameworks and other important tools in this area.
Thank you so much, sir. Thank you so much, ma'am, for your wonderful time. Thank you so much, viewers, for taking out time and watching our videos. Stay with us. We'll be joining you with more videos and more discussions.
Thank you very much.
Thank you.
Thank you.